Well, thank you for joining me here at the Innovation Forum this morning to hear about how Dxplain can expand our diagnostic horizons. As he mentioned, I'm Henry Chueh. I'm an internist at Mass General, direct the lab of computer science, where we use medical informatics to create health IT innovations. The problem I'll be talking about today is something I've experienced, and I suspect that all of you have probably experienced, or maybe a member of your family. I'm talking about the problem of missed diagnosis or wrong diagnosis. It turns out that diagnostic errors are the leading cause of malpractice claims and the leading cause of preventable adverse events in hospitals. Surprised? How bad is it? Studies, including one from the Mayo Clinic, have suggested that estimates up to 1 out of every 6 new diagnoses are wrong. Imagine that. Okay, true story. A colleague of mine recently saw a patient who had a persistent dry cough. Now, this patient had seen not one, but 2 other clinicians, one a partner's doctor, previously, been given the diagnosis of bronchitis, asthma, treated for both, not gotten better. Well, it turned out that he had occult pulmonary emboli. Those are hidden blood clots scattered throughout your lung. Almost certainly would be fatal if left untreated. Now, pulmonary embolism is a diagnosis that every medical student and every doctor learns about. We're all aware about it. We may not see it that often, but we know. So how is it that this is missed? Even expert clinicians will miss diagnoses, even those that they are aware of. The point of my story is that something that maybe seem obvious is that in the heat of the moment, if a clinician doesn't consider a diagnosis, they basically don't know it. The goal of our work with Dxplain is to help clinicians make the right diagnosis the first time and every time. Dxplain does this by expanding the set of conditions or diagnoses that a clinician should consider, particularly those things that are rare or unusual, because some things even experienced clinicians might only see once every few years or maybe once in a lifetime. Now I'd like to show you how Dxplain can help solve this problem. This is a screenshot of a Dxplain user interface that is intended for doctors. At the upper left, the patient is identified as a young adult female with prolonged symptoms, and 3 findings are entered. 1, fever that comes and goes. 2, a rash on different parts of the body. And 3, arthritis, or swollen joints. Now, for those of you who haven't seen the movie, The Big Sick, you might not want to hear this next part, mini spoiler alert. But for those of you who have seen the movie The Big Sick, you might recognize that these are 3 of the symptoms that the comedian's girlfriend had, which landed her in the hospital, where doctor after doctor and specialist after specialist were unable to make the correct diagnosis, and she fell extremely ill, hence the name of the movie. Now, these are 3 very common symptoms. Who hasn't had a fever, or a rash, or a painful swollen joint? In isolation, each of these findings would probably point to a very minor condition or illness, but taken together, they can be signs of something called adult still disease. Quite a serious condition, pretty unusual, not seen very often, but also very treatable. Now with Dxplain, when you enter a finding, it'll immediately generate a differential diagnosis that you can see up there on the right. Differential diagnosis is a list of conditions that could explain the symptoms that are entered. And in this case, they're sorted with the most likely on top. Of course, adult still disease is on this list, as are many other rare and common conditions, even some that are marked as urgent because they would need immediate attention. Now, you already heard from some other speakers that there are some AI systems that can't explain why they come up with the answers they come up with, and that can be an issue of trust. Well, Dxplain can show the user exactly why a condition is on the list. It can show which symptoms trigger the condition, and it can also show which other symptoms might make this condition more or less likely. How does Dxplain do this? Using a large proprietary database that's been curated over 25 years by expert clinicians, Dxplain represents over 2,500 diseases related to over 5,500 clinical findings. Those clinical findings can range from things like clinical history, painful ankle, to exam findings, a raised red rash, to laboratory findings, elevated white cell count, or even abnormal X-ray findings. You can even put in pertinent geographic location. For example, histoplasmosis is mostly seen in the dry US Southwest, and diseases like Ebola, thankfully, are rarely seen on this continent. Now, using those more than 1 million relationships, these are mined using probabilistic inference algorithms to come up with a best-in-class differential diagnosis given any set of symptoms. And even more, the Dxplain knowledge base can be used to suggest symptoms that haven't been considered that might either refine or expand that diagnosis. For many years, Dxplain was available only as a single application, used mostly by medical schools and academic teaching hospitals. But more recently, to expand the impact of Dxplain, we've configured its knowledge base and its algorithms as microservices on Amazon Web. We call this Dxplain Cloud. Now there are robust production application programming interfaces that anyone can use to build third-party custom applications. We also have some widgets to build web apps, as well as a working mobile iPhone app. Now, some of you may have unknowingly already used Dxplain because Dxplain Cloud already powers one of the most prominent consumer-facing symptom checkers on the web. At this time, having been in operation for over a year, Dxplain Cloud can at times get over 20 million API hits per month. Now, given the increasing appetite for AI-based diagnostic tools, we think there is a significant market opportunity for Dxplain-based products and applications, and I'll describe a few. So for the consumer, there are applications for self-assessment or that digital front door. I mean, who among us wouldn't like an alternative to calling the doctor's office and getting that telephone tree? For clinicians, real-time diagnostic support during patient conversations is something that we're already working on in the lab. For hospitals deeply concerned with quality and safety, can you imagine if every clinical note was automatically scanned after the fact to pick up potentially misdiagnoses? Or payers who may want applications that can help triage patients directly to the optimal specialist, bypassing potentially unnecessary visits and tests. And finally, I can't imagine that malpractice insurers wouldn't want diagnostic decision support tools to become standard of care in order to lower premiums. These are all ways that Dxplain can help solve that problem of misdiagnosis. Now, we think the next best step for Dxplain at this point is to find commercial pathways to advance new products to market. That might mean spinning out a startup that develops a portfolio of Dxplain-based products, or it might mean licensing Dxplain to an existing company who already has plans for a product. As always, the challenge is assembling the best combination of team, plan, and funding. And depending on which market one wants to get into, it could be under $1 million to $4 million in investment to get things going. But the key is that Dxplain is ready today, available, and MGH continues to maintain the knowledge base as up to date. We look forward to new collaborations where Dxplain can help solve the problem of misdiagnosis and transform the delivery of healthcare. I'm happy to continue this conversation after the session in the back, give some demos, and I appreciate your time. Thank you.